A very good morning, everyone. This is Namrata, your Bagdara Farms consultant. I'm live with all of you again. And the topic for today's live session is yeast infection in women. I'm going to wait for a few seconds for few viewers to join in, and then I'll start discussing about this topic. Yeast infection is a very common infection caused in women, and if not treated, if not taken care of, it can cause various other complications in the female reproductive system, right? So the topic for today's live session is yeast infection in women. Let's take 30 more seconds and I'll then start talking about this live session. So, okay. Yeast infection, also known as vaginal yeast infection, or you can say it is also known as Candida vulvovaginitis, right? What is it? A vaginal yeast infection is an infection caused in the vagina and the tissues at the opening of the vagina. Now, these tissues at the opening of the vagina are known as vulva. Now, any kind of infection, this is a yeast infection, that is any kind of infection that is being caused in the vaginal area or the tissues that are opening at the vulva are signs of vaginal infection, or like I said, Candida vulvovaginitis. So there are different names given to it, but in simple form it is a yeast infection that takes place in the vaginal area. And what is it caused due to? It is caused due to Candida fungus. Now, Candida fungus is a kind of fungus that invades the system. This is the reason, the main cause of vaginal yeast infections, that is Candida fungus, right? Now they say that 3 out of every 4 women do get this infection. So this is a very common infection which most women face. Like I said, 3 out of 4. So that is a very high probability of women, going through this problem of yeast infection, right? Now, what causes it? Like I said, it is caused due to the fungus, that is Candida fungus, which is there. Now, fungus Candida albicans is responsible for most of the vaginal yeast infections, right? Now, your what happens? Your vagina has a natural mix or a combination of yeast, including Candida, right, and other kind of bacteria. Now, certain bacteria act to prevent an overgrowth of any yeast. So they are good bacteria, they are bad bacteria, right? These are there in our system because there is certain kind of moisture that is required for the reproductive organs to work. There is certain kind of growths of various Candida. Like I said, it is a balanced mix of Candida and other things is required. But like I always say this in most of my lives, that excess of anything is bad. Anything in moderation is fine. So whatever if amount is needed to be staying there, if that much is there, then that does not cause any kind of infection. But yes, when this Candida fungus, when this Candida gets infected and the rate of it increases, that leads to uh, yeast infections in women, or you can say a vaginal yeast infection in women, or Candida vulvovaginitis, right? But this balance, like I said, there is a balance in the, like I said, there's a balanced mix of yeast, Candida, and other bacteria. So when there is an imbalance in this, an overgrowth of Candida or penetration of the fungus takes place in the different vaginal cell layers, that causes various signs and symptoms of yeast infection. Now, Candida albicans, like I said, is the most common type of fungus to cause yeast infections, right? Now, yeast infections caused can be caused by other Candida fungus also, can be more difficult to treat and generally need more aggressive treatments. Now, you need to understand that any problem, any health condition, right? If you do not treat it at the source, if you do not start taking treatment measures at the initial stage when you realize what the symptoms are, if you don't do that, these can really, get into complicated forms of yeast infections, which can further cause more, chronic problems in the body. Now, when I come to the symptoms part, so how do you know if you have a yeast infection or not? You have itching or irritation in the vagina or the vulva. Then, while passing urine or during intercourse, you might feel a burning sensation. There will be vaginal pain, soreness, there will be a rash, you'll see a thick white udder free vaginal discharge that takes place, watery vaginal discharge that takes place. redness or swelling, like I said, that takes place in the vaginal area or the vulva area. So if somebody is having these signs, these symptoms, then it should not be ignored, because these signs and symptoms tell you that there is some form of infection in the vaginal area and or the urinary tract. It can be around any area, but usually yeast infections are caused in the vaginal area, right? Ali Abdul, kahan se ho tum? Sir, I am from Delhi. So these are the symptoms which are there. Right now, there are complications. There are complicated yeast infections which happen. So you might have a complicated yeast infection. Now, what happens is normal white discharge. A lot of women have, right? It is normal to have that kind of discharge, but obviously we do not get to know the difference between normal and excess. Now, when what happens in yeast infections also, initially when you do not get to know, right? Then sometimes this and you're not treating it, it can get aggravated and develop into bigger things. Like you can have severe signs and symptoms such as extensive redness, swelling, extensive itchiness, and this can lead to even tears or cracks or sores that develop in that area, which become very painful. You will have, if somebody is, a complicated yeast infection would be somebody who's having yeast infections again and again. It's recurring again and again, right? So in that case, what happens? That means you're having almost 3 to 4 times yeast infections in a year. Your infection is caused by a less typical type of fungus. Either you are pregnant, you have uncontrolled diabetes. People who have uncontrolled diabetes also have issues of yeast infection. They are very prone to get yeast infection, right? Uncontrolled diabetes, like I said, if your immune system is weakened because of certain medications or conditions such as HIV infection, also. Now, this becomes a complicated form of yeast infection. Obviously, if you let the fungus keep, growing in your body without doing anything to it, then it will seriously start causing side effects on your system, and that is what this yeast infection does in the vaginal area. If not taken care of, it can lead to chronic complications. Now, that also comes with the risk factors. Risk factors are overuse, antibiotic use. Now, what happened? Antibiotic use kills the healthy bacteria also in your vagina, leading to overgrowth of yeast. So, what is the risk factor? Is antibiotics. Most of our human beings these days are resistant to antibiotics because there's so much antibiotics being taken for any kind of problem that is there. So one of the risk factors which come in vaginal yeast infections or yeast infections is that it kills the healthy bacteria that is there in your vagina, which leads to overgrowth of yeast in the system. If increased estrogen levels, usually in pregnant women or women taking very high doses of estrogen, birth control pills or estrogen hormone therapy, this can also be a risk factor for you developing yeast infections. Uncontrolled diabetes, like I said earlier, also uncontrolled diabetes is one of the major risk factors for a person developing, or having yeast infections. And impaired immune system. Immune system, our immunity is the most important thing for our body to grow, for our body to live in a healthy way, and the body to stay away from various ailments, infections, and diseases, right? Now, why am I here? To tell you that here at Bagdara Farms, we believe in alternative therapy, we believe in natural therapy, and that is why we give organic therapy, which we have with our products that are made out of turmeric. Turmeric has a component known as curcumin. Curcumin has innumerable medicinal, therapeutic, and pharmacological properties which can help with not just the treatment but also with prevention and recovery of any kind of problems. Today, like we are talking about this problem of yeast infections, we have a product for yeast infections which we usually recommend is, see, uh, we have two products which are there for women, Shimeric and Minois. So for this, we have a product by the name Shimeric which we recommend for yeast infections. Why? See, during the reproductive years, we have a lot of discharge, we have a lot of activity which is going on in the female's reproductive system, right? And like I said, this problem also happens during pregnancy, right? So what this shimeric does is, shimeric has, like I said, innumerable medicinal, therapeutic, and pharmacological properties. So the properties which are there in shimeric are, it is an antimicrobial agent. That means any microbes that are invading, right? Right. That means it has wound healing properties. It clears any kind of sepsis which is there. It is an antiviral agent. That means if HPV, HIV, influenza, any kind of virus is causing any kind of problems in the women, in the vaginal area or in the reproductive system, then the viral activity plays a significant role in that. It also has antifungal property. That means the Candida species, Trichophyton species, any kind of these species that are invading the system can be tackled and taken care of with the antifungal property of this. Now it also has anti-diabetic properties, right? So like I said, if somebody has uncontrolled diabetes, this can help with taking care of that as well by controlling that thing and by making sure that the sugar levels are in check. Now it also combats drug resistant infections. Like I told you, antibiotic resistance is also there. So this also combats any kind of drug resistant infections which are there. It regulates the inflammatory process. That means any kind of inflammation that is being caused in the system, which is restricting the flow of oxygen blood supply, which is there. So this reduces that inflammatory response so that the system works properly. It also prevents progression of any kind of cervical cancer because of its various anti-cancerous, anti-carcinogenic properties. Yes, you heard it right. It also has anti-cancerous abilities. That means any cancer-causing cells that are invading the system, it will help in eliminating that, and at the same time, it helps in maintaining the health of the healthy cells which are there in the system. Because sometimes, because of the treatments we take, sometimes the healthy cells die too. So it helps with that, and most importantly, because it happens to those who have an impaired immune system, that this product, fast adbactera famshimeric, is the best form of immunomodulatory agent. That means it boosts your immunity naturally. It makes your immunity robust. Once your immunity is strong, you are strong enough to fight any kind of ailment or infection in a better way. Your recovery rate is faster. Your immune system is strong. That means any kind of fungus, bacteria, uh, virus, any kind of thing would think twice before invading your system, because your body would be as robust as any as robust as a rock, so that nothing can invade into your system and cause any problem. So that is what shimeric does, and that is what curcumin in turmeric does. This has innumerable medicinal, therapeutic, pharmacological properties which can help with prevention and treatment of more than 856 ailments in the human body. You can get more details about our products from our website, which is www.bagdarafarms.com. On the website, we have detailed section of our products. You can read all about our products from there. We also have a social media section where we have all these videos which we are doing here live with you right now. We have all of this on that. You can go through all of our videos on various ailments and see how turmeric works for treatment and preventive measures, right? We also have a scientific evidence section which has articles written on the basis of studies, trials, and surveys conducted all across the world on how curcumin helps with treatment of various ailments. On the website, we also have a certification section where you can check our certifications that we are certified by USA FDA and FSSAI. We also have lab reports that show that the curcumin percentage in our products is between 11 to 19%. Because the curcumin percentage in our products is high, that is why these products are given for medicinal and therapeutic purposes, right? You need to understand, if choosing a curcumin supplement, you must make sure that the curcumin percentage in that particular product is high. Curcumin is there in every turmeric, but it usually is around 1 or less than 1%, whereas in our products, the curcumin percentage is between 11 to 19%, and this percentage comes organically. They are not, our products are not they're non-GMO. That means they're not genetically modified. They're free of chemicals, pesticides, fertilizers. One bottle has 60 grams of powder in it. It is a course for 15 to 20 days. For you, we recommend a minimum course of 2 months, because organic supplements take that much time to show results on the body, and for it to reach its threshold and show overall results, it takes a minimum period of 2 months, right? So check all these details on our website, that is www.bagdarafarms.com, or give us a call on our number that is flashing on the screens, that is 9560254646. You can either give us a call on this number or drop a message, WhatsApp. We will address your queries right away and give you the best possible solution for any kind of problems you have. Like today, we spoke about yeast infections, also known as vaginal yeast infections or Candida vulvovaginitis. For that, we have a therapy treatment option. We have treatment options for various other similar problems in the human body, right? So do contact us, because, like I said, curcumin has 287 plus pharmacological properties which can help with prevention and treatment of more than 856 ailments in the human body. That's all I have for the live session for today on this topic of yeast infections in women. I'll keep coming live again with new topics to address and to discuss. Till then, have a lovely day and enjoy yourself. Thank you.